What's up, guys? Dr. Shepard here. I want to talk to you about a topic that can be pretty stigmatizing, but thankfully people are starting to talk more about it, which is definitely helping the stigma thing. But that's the issue of postpartum depression. And I want to talk to you about it in the context of some really awesome, brave celebrities who have started talking about their own battles with postpartum depression. And, obviously I have not treated these women. If I had, that would be a whole nother issue because I definitely shouldn't be talking about them. So this is not meant to comment on their diagnoses or treatment, but rather what I want to do is kind of tie in some of the things that they've talked about with the overall experience of postpartum depression and hopefully use some of those things as a teaching point to kind of talk about the subject a little bit more. Like I said, this is an incredibly common issue. So about 10% of women postpartum will struggle with postpartum depression. And even in those who don't struggle with postpartum depression, you can kind of have a milder form called the baby blues. That's fairly common and it's something that will kind of resolve on its own. Whereas postpartum depression can be really, really sticky and really difficult to get rid of on your own. Although it is possible that it can kind of go away on its own. But the vast majority of times, I think, unless it's really mild postpartum depression, women do need some treatment from a trained mental health professional. So like I said, this is a super common issue, so let's talk about it. Drop me a comment below, and you guys know I can't give personal medical advice, but let's talk about the topic overall and let me know what questions you have about things, and we can certainly talk more about this topic if you guys are interested. All right, so first celebrity we're gonna talk about is Brooke Shields, because I feel like she was the first celebrity, at least in my mind, that I can remember being vocal about postpartum depression. And this was back in 2005, so I was graduating high school that year. Now you guys kind of know how old I am. But anyways, I remember that she was on Oprah at some point and was talking about her severe postpartum depression. And she mentioned that things had gotten really bad for her. She was even to the point of having thoughts about suicide. And then I remember that she opened up about her use of antidepressants to treat her postpartum depression. And then there was this whole shenanigan disaster. I really wanted to say shitstorm, but I didn't. But that's what it was. Where Tom Cruise, who was being really anti-psychiatry, chastised her for being on meds or something. Anyways, that was gross, and he apparently apologized to her later, and she was super classy about it. But I really credit her with kind of opening the door to talk about postpartum depression, because I think even though, we think about, okay, it's the year 2005, we're not in the dark ages anymore. The antidepressants have been pretty common since the 80s, and maybe people are talking about it now, but they really weren't, and especially not someone with as much fame as Brooke Shields had. And I think it's even more amazing that she talked about her use of antidepressants to treat her postpartum depression, because there have been a lot of celebrities that have sort of been very quick to reject the idea that they were on antidepressants for postpartum depression. No, I didn't need that. It wasn't that bad. And, obviously that's fine. If you don't need it, that's great. But I think there is a whole nother layer of stigma that comes with needing antidepressants either in pregnancy or postpartum. And I feel like Brooke kind of went to bat for women when she actually opened up about using antidepressants, and she didn't have to do that. So that was super cool and badass of her. But it is a super important point, because people always think about, okay, what are the risks of using an antidepressant either in pregnancy or after you have the baby? But it's important to remember that we're not just thinking of what are the risks of antidepressants in pregnancy and postpartum. We also have to compare that to the risk of untreated depression. And we know for sure that there are risk factors with untreated depression. For example, and Brooke Shields actually talked about this, problems with bonding with your child after birth. I think it's really important. People think, well, if I can just tough it out without medicines, that's the ideal way to do it. But have a conversation with your doctor, because it's not just about the risks of being on an antidepressant after you have a child. It's also the potential risk of untreated depression. Okay, I am wondering if anybody else is as obsessed with Chrissy Teigen as I am. because I'm pretty obsessed. She is like so real about everything, so raw about her life, and she's really good at like shutting down trolls and being like pretty sassy on Twitter, which I really appreciate. But she did basically the same thing when it came to talking about her postpartum depression. So she opened up to Glamour magazine in 2017 after the birth of her daughter, and she talked about her struggle with postpartum depression. And one thing that she actually talked a lot about, which I think is super important, was this feeling of guilt and feeling like she wasn't a good mom for having this experience with postpartum depression. And that is present in almost every woman that's struggling with postpartum depression. So we know that guilt can be a common symptom of depression in, people who aren't postpartum, but that seems to be magnified. I don't know if it's like a mom guilt thing. Mom guilt is legit, but it seems to be magnified in people that are dealing with postpartum depression. They feel so guilty about everything. They feel guilty about asking for help. They feel guilty about not being good enough mom. They feel guilty about having had a baby. They feel guilty about whatever, everything. Guilt about their guilt. It's everything. But like I kind of alluded to earlier, this is a super common problem. So like 10% of women after they have a baby will go through an episode of postpartum depression. And if you've had one before, you're really likely to have one in subsequent pregnancies. All right, let's talk about a throwback favorite of mine, Alanis Morissette. So I used to like rock out to some Alanis, and honestly, if I'm pissy for whatever reason, if I'm like mad about something, Alanis is my go-to, and I like scream it. I like belt it out in the car. Anyways, so she is someone who also struggled with postpartum depression and was open in talking about it. So she gave a couple of interviews to different magazines, I think People Magazine and Self Magazine, and she talked about her experience with postpartum depression. And one thing that she really hit on, which I thought she described really beautifully, was this feeling of like physical heaviness and just profound fatigue. So let me read you guys what she actually said. So she said, "For me, I would just wake up and feel like I was covered in tar, and it wasn't the first time I'd experienced depression, so I just thought, oh, well, this feels familiar. I'm depressed, I think." So she was experiencing what so many women experience, which is this just feeling of heaviness and profound exhaustion. And this was something that I also talked about in one of my past videos on the physical symptoms of anxiety and depression. It can be really prominent. So she talked about being like barely able to move when she was depressed. And I know you're thinking like, well, you have a newborn, so you're probably not sleeping, so of course you're gonna be tired. And yes, every mom is tired. This is a sort of tired that like coffee can't fix. It's so hard to describe, but it's just so much more than a typical feeling of exhaustion. All right. Hayden Panettiere. So she is so beautiful and so perfect, and I was thrilled to see someone like her with, this total image of like perfection, all-American girl kind of thing going on. I was so excited that she spoke about her experience with postpartum depression, because I think people see people like these celebrities who are just so put together, and they're like, oh wow, well if Hayden Panettiere could have it, then maybe I could have it, and maybe I'm not such a bad person for having it, and maybe I'm not a total loser. So she actually talked a little bit about the etiology and kind of how some of the stigma around postpartum depression is this thought that it's something that's not real. So she said there are a lot of people out there that think it's not real, that it's not true, that it's something that's made up in their minds, that, oh, it's hormones. They brush it off. It's something that's completely uncontrollable. It's really painful and it's really scary, and women need a lot of support. And I think that is such a good point, that we try, as women, we try to like muster through it and pull ourselves up and say, okay, well, I just need to think more positive, or I just need to go and do the thing that I don't feel like doing, or I just need to give myself a swift kick in the butt, and these other moms are doing it, so I know I can do it too. But it's not that simple. There's a lot of research that has come out recently on some of the etiologies of postpartum depression, and it's very interesting. in addition to having some of the other qualities that we see in people with depression that are not pregnant. So for example, the low serotonin levels, in different reactions to serotonin and different responses to serotonin. We also see that women have different levels of various hormones that are important for pregnancy and the postpartum period. There has been a bunch of new research over the past couple years on the use of something called allopregnanolone, which is basically a synthetic form of progesterone. The brand name for that is brexanolone. And it's fascinating. It's an IV infusion, so you have to be pretty severely depressed because you need inpatient admission for this. And it's certainly not without risks. But the fascinating thing is this is basically a synthetic hormone that can really relieve this postpartum depression pretty quickly. So it's interesting stuff, and I think all of the research that's come out on this kind of speaks to the fact that this really isn't something you're making up in your head, and it's not just hormones. It's not like you're moody or something like that. It's profound, and yes, hormones are involved, but I think that even speaks more to the biological nature of postpartum depression. All right, so last one, let's talk about Adele for a minute. So Adele, another beautiful badass, she also talked about experiencing postpartum depression after the birth of her son. And she opened up to Vanity Fair in 2016. And she kind of talked a little bit also about some of the stigma associated with postpartum depression, and primarily the fact that any of us that struggle with it, we don't want to tell anybody. So we're all sitting around together at a mommy and me group, like not talking about how depressed we are and acting like everything's fine. So she said, I didn't want to talk about it. 4 of my friends felt the same way I did, and everyone was too embarrassed to talk about it. So this goes back again to like that guilt, that shame, that bad mom narrative, like always thinking that you're a bad mom or that you've done something wrong. When in reality, like a lot of people struggle with this. It's so common, and it's something that's totally out of your control. And she highlighted that it really helped her to just know that she wasn't the only one going through this. And I found personally that the only way to know that you're not the only one going through this is to start talking about it. So I remember being in medical school and talking with some of my colleagues about some of the anxiety and other struggles that I was feeling. And then people just came out of the woodwork, and I became like the go-to anxiety person because it's so common, but we don't want to tell each other. So we've kind of talked about a couple of the really prominent symptoms, but just to kind of run through a couple others. So it can be kind of hard to tell when you're going through a postpartum depression, because a lot of the symptoms of depression are also something that comes along with having a newborn child. So for example, not being able to sleep. Well, you can't sleep anyways because you have a baby that's crying every 2 hours. If you're lucky. Maybe every 5 minutes. One tip off that I get is, again, this mom guilt thing is huge. Anytime you have thoughts of suicide or thoughts about, life is just not worth living anymore, that's not normal. Struggling with motivation, having just this profound feeling of low energy and fatigue. Anxiety is super common, as are intrusive thoughts, and that's something I'll be posting another video on very soon. So subscribe if you haven't, and press the notifications bell so you'll see when it comes out. But intrusive thoughts in postpartum women are so common and can definitely occur on their own, but can be a sign of depression or anxiety. And most commonly, these postpartum thoughts are actually thoughts about hurting the baby or something like that. And they're things that people get really scared of. Obviously they don't want that to happen. Change in appetite is something that I look out for. So it can be difficult to tell if an increased appetite is due to postpartum depression, because if you've ever been pregnant or had a baby, you know that causes crazy changes in your appetite too. And I know when I was breastfeeding, I was eating everything that existed, but whatever. And then also, yes, insomnia is part and parcel of having a newborn baby, but if the baby is sleeping and you have the opportunity to sleep and you just lay there and are anxious and thinking about things, that's a sign of potentially having postpartum depression or anxiety, you know, not being able to sleep even when you have the opportunity to sleep. So let me know if you want to talk more about this. We can talk about different treatment options next. We can talk about, you know, what are some other symptoms that you might see. Like I said, there are tons of celebs that have been through this. So it's something that, you know, we could talk about, make a whole YouTube channel off of like things celebrities have said about their postpartum depression. So you are not alone. I would say, just as a quick plug for some treatment options, you know, we talked about medications. Therapy can be super helpful. And also it's so important to preserve your sleep. So if you're someone who's struggling with mood problems after having a baby or during pregnancy, you want to really lean on your family and friends, if you have them, to help take care of the baby some nights so you can actually get a good night's sleep. Protecting your sleep, if you are someone that's struggling with depression or bipolar disorder or anxiety after your baby is born, that is so important. And as soon as your body is able to do it, exercise can be really helpful too. So there are a lot of different things that you can do to help with postpartum depression, and it's just about having a conversation with your doctor or your therapist to kind of figure out what works best for you. So like I said, hit like if you like this video. Please subscribe if you haven't already, and let me know in the comments what else you guys want to know. See ya.